Hi, this is Dr. Raj Singh. I have a sexual health clinic in Las Vegas where we deal with all sort of sexual health issues for men and women. Today, the topic of discussion is porn and its effects on health and relationships. So if you are not comfortable listening to discussion about sex and porn, then this would be a good time to watch a different video. So you've been warned. Okay, so the reason behind making this video is because although porn is everywhere, its effect on health and relationships are not often discussed. Not only patients, but also doctors are uncomfortable discussing this topic, although it has so many effects on overall health and sexual function. Now, sexual dysfunction is becoming more common, and I'm seeing erection issues, orgasm problems in men as young as 30. This was never such a big problem in younger individuals in the past, so there must be something going on. We all know that we have more exposure to environmental toxicity, pollution, stress, and all these factors do play a role in sexual dysfunction. However, one of the biggest factors leading sexual dysfunction nowadays, I believe, is exposure to porn, and this is often not discussed. Now, in our sexual health clinic, I'm just seeing so many individuals with diminished sex drive, delayed ejaculation, orgasm issues. Now, lack of sexual pleasure and satisfaction are so prevalent in both men and women. For men, it's mostly erectile issues during real sex, and for women, it's primarily issues with orgasm. The next big question is, who watches porn? So let's look at some statistics. So survey shows that more males than females view porn. One study found that 76% of females between ages of 18 and 30-year-old watch pornographic material. Now, this number does decrease as women age, and only 16% of females were watching porn by the age of 50. About 60% of married men report viewing porn as opposed to only about 25% of married females. So men, we have a problem. Now, let's start by looking at the positive aspects of porn. Porn may help improve communication about sex with a partner, may help reduce anxiety related to sex for the very first time, and may help open one's mind about sex, such as heterosexual sexual behavior, homosexuality, and also transgender sexual acts. It might have some positive effects as well. How about the negative effects of porn? So the most important one, I think, is unhealthy body image. So we all know people are getting more boob jobs, butt implants, penile enlargement surgeries. Now, erectile dysfunction is common, depression, performance anxiety, unhealthy image of sex. Real sex becomes less pleasurable and masturbation becomes more fun. So that's a problem when we watch porn. Leads to other addictions with alcohol, smoking, delayed ejaculation, where men can easily ejaculate using masturbation, however cannot have an orgasm or climax inside a vagina. Death grip, where men masturbate with such a tight grip on their penis that the penis gets desensitized by using extreme pressure and motion. And these men develop sexual dysfunction during sex, but not during masturbation. Now, women experience delayed or lack of female orgasm as the clitoris and vagina gets desensitized from using a vibrator. Of course, prejudice against women. Also, we are training the brain to get excited by watching other people having sex on a screen. Development of a belief that women are weaker, they're submissive, willing to be dominated sexually. Now, others believe that men are more dominant, more powerful, and have greater sexual needs than women. That can affect both sexes. Now, one researcher described the motivation to use porn in 5 stages. Discovery, followed by experimentation, then escalation to more material, compulsion, and eventually hopelessness, where we call it addiction. Now, is porn addictive, or it is just made of fear by religious conservatives? So I can tell you, the porn is highly addictive, and it's compared that to crack cocaine. Just like any other addictive drug, such as sugar, alcohol, cocaine, our brain's reward center gets activated, gives us a high, which is a good feeling. Now, this is followed by a low, where we are depressed, we are disengaged, and irritable. We need to consume more of the same drug in order to achieve that high. So overall, this leads to overconsumption of pornographic material, and then we need to watch more and more extreme pornography in order to get sexual stimulation or orgasm. Now, the reward center in the brain is located in the ventral striatum, and you can see this in the red dot here in this picture. Okay. So moving forward, why is porn so addictive? And why is it so difficult to quit? The problem is that when we watch porn, it changes the chemistry of the brain. It changes the hormone and neurotransmitters. So when pornographic material is consumed, dopamine gets released, which is our pleasure hormone. Now, individuals consume more and more porn to feel any pleasure over time. So as we continue to stimulate our reward center, the concentration of dopamine goes down, and eventually we feel miserable. Now, the reason we feel miserable is because we have depleted all of our brain's dopamine reserve. So nothing brings pleasure or joy to life except watching porn and masturbating. So porn is consumed when the individual is sad, or they are happy or anxious, and just becomes a vicious cycle. Now, a reasonable question would be, why cannot we give these patients just more dopamine so that they can feel alive, they can feel better, and be less depressed? So we actually have a drug form of dopamine, which is used to treat patients with Parkinson's disease. Now, when these patients with Parkinson's are given dopamine, they feel really good. They have significant improvement in their symptoms of Parkinson's, like motor strength and speed. However, these patients also develop a lot of compulsive behavior problems, hypersexuality, addictions, gambling, obsessive sexual behavior, obsessive compulsive disorder, and much more. So giving dopamine is not the answer to treat addictive behavior such as pornography or any other addiction. Let's look at the chemicals of porn in the brain. So first we talk about dopamine. It causes a sharp focus and a sense of craving. Norepinephrine is released, which causes alertness and focus. Oxytocin and vasopressin, they help link memories of porn images and pleasure. Endorphins are naturally released by our body that are related to opiates, and they provide, again, happiness and pleasure. Serotonin brings calm relaxation and accomplishment after orgasm or climax. Now, this excellent book, The Brain Changes Itself, the author described how the continual release of dopamine into the reward system, when an individual compulsively and chronically watches internet pornography, it stimulates some neuroplastic changes, so that reinforces the experience. And these changes, they build brain maps for sexual excitement. So moving on, so erectile dysfunction. So in about one study, 60% of the patients who suffered sexual dysfunction with their real partner did not have this problem with pornography and masturbation. Of course, psychological dissatisfaction. So pornography use, we know, has been associated with sexual dissatisfaction and sexual dysfunction for both males and females. Being more critical of one's body or their partners, or increased performance pressure and less sexual sex. Having more sexual partners, engaging in paid sex behavior, those are some of the things that happen with watching too much pornography. Now, Kinsey Institute researchers were among one of the first to report pornography-induced erectile dysfunction and pornography-induced abnormally low libido. So in their study, the subjects were recruited from bars where video pornography was widely accessible. They were unable to achieve erection in the lab in response to video porn. Now, these researchers, they redesigned the study. They added more kinky clips, more extreme porn, also allowed users to select their own content. And even after that, still about 20-25% of the participants were not able to perform sexually. So when a user has conditioned his sexual arousal to internet porn, sex with desired real partners may not meet expectation. It results in decline in dopamine. And since we don't have the ability to click and change our sexual partner right then and there, the brain decides that internet pornography is more pleasurable than actually having sex. Another interesting topic is the sex fetish and association. So some interesting studies I came across. The first one is on rats. So in this experiment, male rats were allowed to have sex while wearing these tiny jackets. Over time, the brain started associating these jackets with sex. So when you take these jackets away, these male rats developed erectile dysfunction, were not able to have erection or an orgasm. Now, human study. So in this study, male participants, they had the measurements of the amount of blood flowing into the penis, showing that how much excited they were. Now, they were shown images of boots over and over, followed by images of sexy naked women. So after repeatedly showing the men boots, followed by nudes, the men eventually started showing arousal in response to just the boots alone. So the experiment was able to successfully condition a fetish about boots. So that's how our brain works. So we can have associations. Now, when it comes to treatment for porn addiction, so there are some antidepressants such as paroxetine, which can help with the anxiety, but not so much the behavior. Also, antidepressants have a negative effect on sexual function. They cause erectile dysfunction. Also, they have decreased sex drive. I rarely use them for cases involving sexual dysfunction. Naltrexone is another promising drug, shows benefit in behavior addictions, hypersexual disorders, may help reduce cravings and urges by blocking the pleasure that associated with watching pornography. Unfortunately, no randomized trials, so this is all based on few clinical experiences and some case reports. So some final thoughts. So combining psychosocial, cognitive, behavioral, and pharmacological methods is considered the most efficient in treatment of sexual addiction. Now, brain recovery from porn addiction can take 3 to 6 months or longer and depends on the length of porn exposure, the type of porn consumed, and of course, overall health. Avoid watching pornography material that includes sexually explicit images on social media, of course. When watching porn, only watch soft porn and not extreme pornography. Avoid death grip to prevent penis desensitization. And women need to avoid using vibrator to prevent desensitization of clitoris and vagina. And above all, if you suffer from porn addiction, seeking help is just like any other addiction, and it's nothing to be shameful about. We all need help, and acknowledging that you have a porn addiction is the first step towards finding a solution. So challenge yourself today and stop watching porn. Within a week, I assure you, you're going to notice improvement in anxiety, depression, and you will start enjoying the little things in life. Now, dopamine is a good guy, and we need dopamine to feel happy and alive. Dopamine helps us develop relationships. Dopamine helps us fall in love. And as we all know, there's nothing more magical than being in love. So thanks for watching. And if you like the video, please don't forget to comment and press the like button. And also, please do not forget to subscribe. I will see you back in a few weeks with another interesting topic. This is Dr. Singh from Las Vegas. Take care. Bye-bye.